Welcome to Ageism and its Impact on Health. I am Tammy Geltmaker, Program Director for Qsource, and I'm joined by my colleague, Cathy Wray, who serves as a Quality Improvement Advisor. Ageism is a worldwide issue. The fact that it is so prominent in each and every country led the World Health Organization to initiate a campaign in 2016 to combat ageism, to make sure we live in a world for all ages. During today's presentation, we're going to explore different aspects of ageism, including the definition, examples, its impacts on society, as well as strategies and resources that providers and other healthcare professionals can use to combat and overcome this issue. Ageism refers to the stereotypes, how we think, prejudice, how we feel, and discrimination, how we act toward others and oneself based on age. Ageist beliefs and attitudes can be explicit, something you do consciously, or implicit, something you're not aware you're treating someone differently. And these beliefs, attitudes can be manifested at a variety of levels. Ageism can be institutional, referring to the laws, rules, norms, policies, and practices of institutions that unfairly restrict opportunities and systematically disadvantage individuals because of their age. An example might be policies in a health sector that allow care to be rationed by age, and in the labor sector, where there may be discriminatory hiring practices or mandatory retirement ages for certain professions. Ageism can be interpersonal, arising in interactions between two or more individuals, and can be exhibited by disrespecting or patronizing older and younger adults, or using an overly accommodating tone and simple vocabulary and sentence structure when interacting with older adults. Self-directed ageism can occur when ageism is internalized and turned against oneself. An example of this might be when someone doesn't apply for a job because they think they're too old or they're too young, regardless of the skill set they may have. Ageism is everywhere. It's one of the most prevalent, least recognized, and normalized forms of stereotyping and prejudice within our society, and often intersects with other forms of disadvantage. Every person who grows older is likely to be the target of ageism at some point in their lives. There are many examples of ageism. The examples on the screen are not the only ones that exist, though. Attributing forgetting to our age. As we get older, we start attributing memory lapses to our age or perceived cognitive decline. However, research tells us that perceptions of age-related memory loss are actually overblown. Lack of ability or unwillingness to use technology or interest in continuing education, this continues to be a commonly portrayed stereotype in ads or marketing. While in reality, most active agers have some level of technological sophistication, such as using smartphones, texting, shopping online, or communicating with friends and family through the internet. A number of older adults are also interested in pursuing their education as they look for a second chapter career, want to stay competitive in the workforce, or simply just want to learn something new for personal development. Depiction of older individuals as frail and or dependent or no longer active. This is a very common form of ageism that we see in written word, pictures, and advertising. And because of this, we've seen initiatives begin, such as changing the narrative, that encourages organizations to counter the depressing narrative that can be associated with getting older. Viewing aging as something to fight or avoid. This can be seen particularly in gendered ageism, which is the intersection of age and gender, and it refers to the differences in ageism faced by women and men. Now, while women and men may experience this to some extent, women tend to be targeted at a greater rate with anti-aging messaging. Ageist talk or elder speak is a way of speaking similar to baby talk. And this is with high-pitched, exaggerated tones and volumes due to the assumption that the person may have difficulties with cognition or hearing. May also include referring to someone as honey or sweetie simply because of their age. Now, ageism is not just about the things that you say or write. Ageist behaviors can also include undertreating older adults, including underrepresentation in clinical medical trials, and by lumping all aches and pains of an older patient into a pack labeled, "These are normal signs of aging," and ignoring other causes of complaints, such as lifestyle, relationships, and home situation. Ageism can also include overtreating older adults by giving health guidance or medications based only on their age while excluding their preferences, abilities, and functionality. While any of us can experience ageism, there are certain individuals who may be more at risk, such as those who are older, care dependent, or work in a certain profession, such as high tech, entertainment, or hospitality. At this time, I would like to turn it over to Cathy Wray, who will talk about the impacts of ageism, as well as share strategies that can be implemented.
Defining ageism beyond the textbook and its impact on you as an individual can be crucial in understanding how it relates to others. Asking yourself, do I have an implicit bias with aging adults? Am I discriminating against my future self? Taking that inner look of how we view ourselves can impact how we treat others. Eroding the solidarity between generations, taking a closer look at what that means in your organization. Devaluing or limiting our ability to benefit from what younger and older populations can contribute is a question that we often ask ourselves. How do we hold others accountable for participating in these behaviors? Are we being intentional and learning from each other in teachable moments? Are we practicing self-reflection with avoiding categorizing with us versus them? And are we enhancing the change for narrative when we practice proactive approaches? Ageism does have far-reaching impacts on all aspects of health and well-being when we are older. Ageism can be associated with earlier death, can be linked to poor physical health, can be linked to risky behaviors, or poorer mental health. It can also be a lower quality of life, and it can lead to social isolation and loneliness. Ageism affecting older adults can lead to factors such as food insecurities. This was a common concern within many of our Qsource community coalitions across the state of Indiana. For example, some older adults that have limited access to employment opportunities, therefore resulting in limited income, can access certain programs in healthcare, putting limitations on different food opportunities on what they can and cannot afford. Ageism also has effects with ethnic disparities with Black non-Hispanic households. They are nearly twice as likely to have food challenges more than the national average. Hispanic households have a prevalence of food insecurity of 18.5%. And divorced seniors, older women, and those that have never married have a higher disparity rate also. LGBTQ seniors have a higher rate of living in poverty also. And transportation and the ability to reach care within the range of their home, having to rely on public transportation and being left to their own devices for rides and services. The impacts of ageism with food insecurities leading older adults to have 78% more chances of experiencing depression, 40% more likely to experience chest pain, and 55% more likely to develop asthma, 10% more likely to experience high blood pressure, and 21% more likely to experience limitations in their activities of daily living. So as we talk openly about strategies to reduce ageism, it's important for your organization to look at your policies and laws to reduce the inequities and discrimination that might exist in any of your age groups. Providing a review and assessment of current practices and policies and procedures is a great place to start. Creating a platform for organizational self-assessments. Asking yourself, does your organization create diverse experiences, equal opportunities, inclusion for intergenerational opportunities? These are all great places to start. Providing basic education on the normal aging process is another strategy. Challenging our inaccurate stereotypes, such as that all older adults live in nursing homes or have all the same experiences. We can change our perception and our view of how aging is a normal process of living. It does not necessarily include that a person is disabled or has a disease or is in a state of decline. Changing our perception of work and retirement is therapeutic. It's a way to stay active and engaged, and does not mean I am poor and in need of income. We can address institutionalized ageism to remove barriers that are prohibiting older people to engage fully in civic and economic activities by providing them more opportunities to be involved in the community through activities such as volunteer work, mentoring, or continuing on with their education. Again, as we talk about strategies, these are some high-level strategies, global strategies that are promoted by the World Health Organization. Again, for your organization to review. A few of these include avoiding overgeneralizations, avoiding problem statements. We may be using phrases like silver tsunami or the graying population, implying generalizations. We want to avoid euphemisms, which is a polite expression used in place of words or phrases that might otherwise be considered harsh or unpleasant. Misleading or dishonest word can be another strategy, for example, using sensitive understanding for the person's situation without pity. Using that neutral language, avoiding terms that can be stigmatizing or associated with lower competency. Instead of saying old man, granny, old person, the elderly, replacing them with older woman, older man, older people, or using people's names instead of generalizations. It's relevant to be age specific sometimes. People who are 20 years and older or 60 years and older. We want to avoid othering, which is again categorizing they versus us, or they and them to refer to older or younger individuals. It's recommended that we use more inclusive language by replacing these words with we and us. Choosing images wisely in your organization, practicing communication efforts that portray a wide range of ethnicities. Reflecting on older people does not represent all realities. Priorities should be made for this in your illustrations. And again, utilizing local and state national resources, bringing awareness to ageism in our society, our workplace, and our community.
The information on this slide was taken from the National Center on Elder Abuse Research. The number of individuals 60 years and older is growing. It's expected to triple in size to 2 billion and account for 22% of the population by 2050. It's important to note that many older persons are living independently, actively engaged with others, using technology, and participating in activities they enjoy. Overall, individuals 65 and older are growing in the workplace, as well as volunteering in their communities, and continue to add value to society in different ways. Older people from multi-generational work teams boost productivity of those around them, and these teams perform better than teams of just single generations. Now, this is particularly important in healthcare. Seniors make up 30% of the physician workforce in the U.S. and are the linchpin in patient care and medical education. Older individuals do have a vital role in society. With age often comes a greater sense of acceptance of self and of others, as well as memories and lasting life experiences that can contribute to wisdom, empathy, and gratitude. In addition to the information contained in our presentation, we've also included additional links on the resources slide to help you combat ageism. Thank you for joining us, and we hope that you enjoyed today's presentation.